Hi, I'm a patient at Natural Dentist Associates. I am 38 years old, and today I'm going to talk about having my root canal teeth extracted and replaced with dental implants. I had two root canal teeth in my mouth. One was an upper left molar, the other was a bottom left bicuspid. The molar I had for about 10 years prior to having it extracted, and the bicuspid I had for about 4 years. And I saw Dr. Adams at Natural Dentist Associates because I had done research about root canals and how the health in my mouth correlates to the health of my overall body. And based on what I learned, I no longer felt comfortable having the root canal teeth in my mouth. When I had the root canals done, I was just told by my dentist at the time that it needed to be done because it was more decay than could be taken care of with a filling. But I never really understood that when I had a root canal that I now had a dead tooth in my mouth. So once I understood that I had dead teeth in my mouth essentially, and really what that could do to my body and immune system, I realized that it wasn't something that I wanted anymore. So I went for a consultation with Dr. Adams, and he really did a great job explaining to me all the pros and cons of extracting the root canals and having them replaced with dental implants. He also did x-rays just to see if there was anything going on right now in my mouth because of the root canals, any infection or anything like that. So Dr. Adams didn't see any signs of infection around the root canals that were visible from the x-rays, but he really respected the personal decision that I had made to want to have them extracted anyway. And so I decided to go forward with the procedure to have the root canals extracted and replaced with dental implants. So I scheduled a visit to come back to the office. It was about a 90-minute visit. I was really nervous having it done because prior to that, I'd had my wisdom teeth extracted. I had teeth as a child extracted, some of my permanent adult teeth, but it had been a really long time since I had had anything like that done. And I probably had just normal jitters going into it, and I also felt a little emotional about having my adult teeth removed. But everyone at the office was really nice and comforting, and Dr. Adams really took the time to explain the whole process to me and really make me feel comfortable with what I was going to be going through. So the day of the tooth extraction and implant placement, I was there for about 90 minutes, and basically I decided not to do any type of sedation, but they did offer it to me. I just decided just to do the local anesthetic, and I did bring headphones and listen to music while I was having it done, which was calming. It took about 90 minutes, had my teeth extracted, implants put in. For the implants, I got a zirconia one in the bottom because it's tooth colored, and I was concerned for cosmetic reasons that there could be some metal sheen through the gum if I went with a titanium one. And in the molar site, I went with a titanium implant just based on Dr. Adams' recommendation that that was the better implant for that site because it was a large tooth that he was replacing, and that the titanium implants hold up better in molar sites where they're getting a lot of force from chewing and things like that. So like I said, I was there for about 90 minutes, and then after I didn't require any sutures or anything like that, I went back to the office about a week later to have a post-operative visit, and everything really healed well. I was obviously a little bit sore afterwards. I didn't take any of the prescription strength medication, but I did take ibuprofen every 6 to 8 hours, and then I took the antibiotics that they prescribed. And I would say, because people always ask me when I talk about that I got dental implants, they think it's such a major procedure and what is the recovery like. It really wasn't that big of a deal. For the first day, I was just eating on the other side of my mouth. I didn't work out for a couple days. I kind of took it easy. And I had the procedure done on a Friday, and by Monday I was totally fine to go back to work. And by Monday, you know, the next day I wasn't chewing on that side either, but about 2 days later I was soft foods and I was totally fine. The one thing that I would say that takes a little getting used to is it does feel a little weird not having teeth in your mouth, because when you have the implant, it is flush with the gum line. So I know Dr. Adams told me if it was one that really showed with my smile that they had like temporary options they could give, but since both of mine were really, you couldn't see when I smiled, I just didn't have anything there. So it definitely did take a few days to get used to not having those teeth there. So during the procedure, one of the things that really caught me off guard was when first he removed my lower tooth and everything was pretty uneventful, put the implant in, and took less time than I expected. But when he removed the upper molar tooth, there was the most horrible smell you could ever imagine, and the taste in my mouth was just putrid, horrible. The tooth actually had a really large cyst on it, one that couldn't be observed in the x-ray because we had x-rayed the tooth about a week before when I had come in for my initial consultation with Dr. Adams. So that was really, after I saw that, it really validated for me that I had made the right decision by having the root canals removed. So now I am more than 4 months out from my initial procedure, and I actually have my final crown on. Let's see, it's this tooth right here. And I couldn't be happier with it. I actually have some gum recession from some TMJ issues that I have, which I'll talk about in another video. But the gum around my implant tooth is better than the gum around the rest of my teeth. So I'm really, really happy with the final result. I did decide about the time that I got the final crown for my lower implant that I didn't want the titanium implant in my mouth. I did more research on having metals in my mouth, and I just decided for me that I didn't want any metal in my mouth. And I was really actually pretty embarrassed that I had just had it done and then felt like I wanted to have it out. And Dr. Adams was so understanding. That's one thing that I really like about the practice. They really listen to their patients and what they, really consider what the patient feels is best for them. And he understood the way that I felt, and he actually removed the titanium implant. And for anyone who wants to know what that process is like, it was just very similar to having a tooth extracted, and it was done about 4 months after it was placed. So it had integrated a lot with the bone, but not fully. So he was able to get it out without creating any additional bone loss. And then it healed just as an extraction site would heal. So it was a pretty easy process, and now I'm fully healed and I'm getting ready to get it replaced with a zirconia implant. So that was my overall experience. I'm really glad that I had it done, especially when I saw the big cyst that was on my upper left molar. And I would definitely say for anybody considering having it done, it never hurts to educate yourself and explore all of your options. So I just encourage you to do research online, make an appointment with one of the dentists at Natural Dentist Associates and go in and have a consultation. Inform yourself and just make the decision that you feel is right for you. I'm really glad I made the decision that I did. I can say that I am really happy with my decision to have my root canal teeth removed and replaced with dental implants, especially once I saw the cyst that was on my molar tooth when it was extracted. That was really validation that day that I made the right decision. But I've also for a very long time had this like phantom itching right behind my root canal tooth. And I never really knew why it was there. I thought maybe it had something to do with having a wisdom tooth there, and then it was gone. But ever since I've had that root canal tooth extracted, the itching isn't there. So for me, that's just, more validation that my body really was reacting in a negative way to having the root canal tooth there. and I'm really happy that I made the decision that I did.